We have covered pregnancy, lactation, children, toddlers, children, adolescents. We have covered menopause, right? So I think that was our last menopause. Have we covered elderly male? Yes or no? Please write in the chat. No. Correct. We'll do elderly male. Those who are interested for learning or reading geriatric nursing care for family caregivers. So I have completed this book. It will be on Amazon in next 2-3 days. So it's more of a practical approach book. What you should do, you as a family caregiver or as a nurse. Nurses also can read. So primary target is family caregivers. So at home or in hospital, including the fall, infection, long-term diseases, prevention, correct diagnosis, understanding their emotions, pain, and certain tough decisions. So it's very good. All the conditions are covered in that book. Geriatric, practical geriatric nursing for family caregivers. That is a book title. So if you want to buy, you can WhatsApp me after 2 days. I will send you link, or you can go on Amazon, search my name, you will find it. So this book will be on Amazon on Wednesday. Minimum cost. So we should take parallelly elderly female and elderly male. Elderly female, the biggest milestone will be menopause. Another milestone will be emptiness syndrome. Don't forget that. Yeah, children have gone for further education or marriage or studies or maybe job or something, okay, or maybe some other reasons, personal reasons. Menopause, emptiness syndrome, increased risks of cancers. That is a time. Okay, increased risk of heart attack. So yeah, earlier estrogen hormone was protective, and now after menopause the risk has increased. Then increased risks of bone density decreased, more fractures, all those, skin wrinkling, looks, confidence, emotional turbulence, all those things. Right? We always have been assuming that male are the strong population and they don't have emotional turbulence, they don't get depressed, they don't get sad. They also go through emptiness syndrome. Male. At that, like at particular age, maybe 45, 50, elderly male we call it. So they will have low testosterone. Testosterone will decrease. Okay, it may not decrease as significant as estrogen in female body, but it decreases. Because of this decrease, the protective function of testosterone for their body, muscles, bones is decreased. So increased risk of fractures, weakness, decreased performance, decreased interest in previously interested activities. That is a time when probably they are worried about their retirement, the family, and the future, and all those things. If child goes outside the house for studies and education or marriage, that is emptiness syndrome. That is another problem. Reduced testosterone, increased risk of fractures and weakness. Then emptiness syndrome, burden or stress of retirement. The last one will be increased risks of heart attack, diabetes, and cancers. In male population per se, cancer risk is not so high before 60. Okay. So at early age they have one risk, but but they have come to this stage now, so that risk is gone. That is behind now in future. So obviously prostate cancer risk is there and colon cancer. So these are the two major cancer risks in male population. The female population cancer risks will be number one will be breast, cervix, uterus, typically. Okay, rarely ovaries and all. So we consider breast, cervix, and uterus. Cervix can be prevented or can be treated at early. So yearly pap smear and can be prevented by vaccine. correct? Cervical vaccine. The cervical vaccine has to be taken in your early age, before 30 years. Okay. Now, male population, the prostate may become larger, obstructing the urinary or bladder flow, or they may develop prostate cancer. Colon cancer is another risk if they are at a higher risk population, okay, because of food and all those things. And genetics also plays a role. So majorly testosterone is low, increased risk of bone weakness, muscle weakness, stress of retirement and funds and finances. If Barka you are done, we should start. So, and then increased risk of heart attack, stroke, diabetes, and certain cancers. Correct? Do we need to do some routine test? That is one question. Can we prevent something? Can we delay something? And as a nutritionist dietitian, what you are going to do? Many times in the market, nutrition dietitians, they think that only they should think about the food. No, my dear. You have to think of what can be done to diagnose early, what can be done to prevent certain things, and what can be you do. Tell them the food and lifestyle changes. So that is only one part of it. The major part is here. Right? So when you get an elderly male for like, I want to meet you, I want to consult with you, what should I do for my health and all. So the number one step is going to be the blood test. So what are the blood tests you will do? Don't do testosterone. Not required, because though you will find out, yeah, testosterone is low. Yeah, after that what like bus, right? And the cost is high, 1,000 rupees for testosterone. You don't want to spend that, patient doesn't want to spend that. Unless they request it. Unless they go for a platinum package of 1 mg, which involves all the tests. Yeah. So obviously not required. Then go for a gold package. Okay. So gold package includes all the tests except the testosterone and one or more. One of. Okay. Doesn't matter. You don't need to do hormone profile here. Doesn't matter. Doesn't give any data. Next section what? But the major you will do is CBC, LFT, KFT, kidney function. The most important is HbA1c for diabetes. And cardiac risk markers. So what will cardiac risk markers? See, there are in cardiac, like when someone already has heart attack, then you will do serotonin, troponin and all those things. Okay, troponin and right, cardiac risk markers. Okay, serum troponin. But if before that there is something more, there are two things. One is homocysteine. Okay, and another is lipoprotein B. So if you do these two things, you know this person is a higher risk or no. So homocysteine is it predicts there is overall increased risk of heart attack or overall risk of stroke. Okay, majorly heart attack here. Lipoprotein B is more about heart attack and stroke both, because lipoprotein B is related to cholesterol. Okay. Obviously, you will do lipid profile, yeah, LDL, SDL and all. But you know, that doesn't give so much whether you are going to die. So that is a question. How likelihood you will die? How likelihood you will develop heart attack? Okay. So that answer is lipoprotein B for heart attack as well as stroke. And for homocysteine, it is a heart attack, ischemic heart attack. Correct? So these two tests you do, means in that all the tests, you will include this two also. Hormones not required. KFT, typically most of the males KFT is normal at this time. Okay. Now the question is, should we do prostate examination and PSA, prostate specific antigen? Not required. Okay. Only they will do that when they have symptom, because it is not comfortable. Okay. So obviously that is done by surgeon. Okay. So that is not required prophylactically. So in female, there is a breast examination for finding any lesion or tumor early, right? There is a cervical pap smear, okay? But in male, there is no recommendation for such things. You understand? So for high risk population, high risk person, there is a recommendation of colonoscopy every year, okay? But you know, again, that is discomfort, people don't do it. And in India, there is no culture for every year colonoscopy, unless somebody is extremely high risk, okay? So there is no other test they need to do. Now it's a good idea because this is elderly, this has a high risk of heart attack, high risk of this. So better to do ECG and 2D echo from a cardiologist. Okay, they will give the report, you read the report and tell them that see this looks better. So it means if you start exercise now, if you start coming to me every week and paying my fees, and if you start following what I'm going to tell you, there is a good likelihood you will survive more than your spouse. There is a good likelihood you will have better quality of life. That's a competition, right? So at least in the middle age, okay. And then once they reach the older age, they are like, are we still here? So in the middle age, it's like, are you still here? And elderly ages, are we still here? So that will come to that old age population. Don't worry. So what are the tests you will do? CBC, complete blood count, liver, LFT, liver function test, kidney function test, lipid, okay, thyroid. Thyroid is recommended for female, but you can do for male also because in gold package it is a part of the package. Yeah, it is silver package also, very low cost thing. Yeah, you do it now. So you can do either in thyroid, you can do in 1 mg. Cost is very minimum. Hormones not required. Cancer risk markers not required. Cancer screening not required. Not recommended unless high risk. Now the screening for diabetes, which is HbA1c, screening for heart attack and stroke. Heart attack will be homocysteine and stroke and heart attack will be lipoprotein B. Correct? Now if lipoprotein B is high, you need to tell the client, see there is a higher risk of heart attack, but you are still not got the heart attack actual. So you can still, yeah, live a quality life. Prevent it. How will you prevent it? Very simple. Every week you come to me and pay my fees and see me, and I will talk something, I will tell you certain things, you follow that, it will prevent it. You will have better quality of life. Okay. So there are certain claims. Now we talked about the testosterone. Okay, there are certain claims of certain herbs or certain things that increase the testosterone level. Nothing works. Okay, if you want to increase your testosterone level, the best is exercise. Okay, and that is not your target at this age. Okay, your target is to prevent heart attack, diabetes, delay diabetes, prevent stroke, maintain the active life. Okay. Now there is one more thing. There are certain male population either because of stress or genetic factor or because of certain things, they are at a higher risk of cognitive decline. Cognitive decline means they may have difficulty taking decisions or thinking clearly. You know, the clouding of thoughts or fogginess of thoughts is there in menopause also in female. Here, there is more of the memory loss kind of thing. Okay, it may not be frank dementia. Okay, it may not be frank Alzheimer, but maybe precursor to that. Okay, probably because of the earlier stress, the lifestyle, or whatever the things, you know. So if you ask like when you are in stressed or when someone cries, yeah, it is better to cry actually, you know, because you are not trapping your stress. So those who do not cry, they trap their stress so much that it affects their later life. Okay, so if you are someone who cries regularly, that's a good thing. Every time you cry, make sure that you swipe your credit card, your spouse credit card, and buy something for you. So what are the physiological changes? Testosterone will reduce, then sleep may get affected, fatigue, lower stamina, reduce muscle, and this muscle will be replaced by fat. They may have low confidence and forgetfulness. Okay, so we are not writing dementia, Alzheimer. No. We are writing more of a cognitive decline in terms of thought process, decision making, and Forgetfulness. Okay, forgetfulness is a good thing. It helps repair marriage very well, and but all other symptoms they are not good. Okay, because then children start saying that "budiya sa dah gaya hai," you know. So all those things. So to prevent that, there is only one and simple method. You have to visit me every week, pay me my fees, and I will tell you certain things to do. You will do that. If you do it on your own, it doesn't work. So you have to do it only when I have tell you, and after you pay me the fees, so the effect is much better. Comorbid conditions. So heart disease, hypertension, diabetes, prostate, osteoporosis. Increased risk of fracture. For both the patients, male or female, you will need to take care of prevention of fall in the bathroom, okay, to prevent head injury or fractures, because then you will need to take care of them. Yeah. What will happen if you have low testosterone? So this testosterone, it is so talked of for male. Like it's like something they are talking like it's like something that you can change it, or you can give testosterone injection, or you can eat something that will increase testosterone. No, my dear, that is a physiological thing that is happening, same as estrogen. Okay, so instead of working on increasing your testosterone level, which people tend to do that by eating some herbs or tablets or something, which doesn't help. Instead of that, you should focus on exercise, learning new skill, doing some activity, okay, and maintaining your diet, okay, food and nutrition, and regular health checkups, and visit to the nutritionist regularly. But anyways, because you should know what is going to be physiological changes for this, so you should know that in muscles, the muscle will get replaced by fats. If you do not exercise, bones will become weak, and you may increase cholesterol. LDL will increase, HDL may decrease, and you may have increased risks of lipoprotein B, which increasing the risk of stroke and ischemic heart attack. You may have increased risks of heart attack because of homocysteine. Not because of homocysteine, actually, when there is increased risk of heart attack, homocysteine increases. So that is a predictable thing. Then your dopamine will decrease. To increase your dopamine, what you do, you increase your serotonin. Where is the source of serotonin? Serotonin is secreted in the intestine with the help of microbial flora. So you drink Actigo Pro regularly, you eat probiotics and fibers and fruits, and prevent stress. By this time, the stress of your life should have decreased because you are being forgetful. Yeah, and try to have a happy life. I don't know how, and emotions. Take care of your emotion. This is a very bland statement, vague statement. Take care of your emotion. Yeah, yeah, yeah. I will take care of my emotion. Uli, uli. Is it like my remote or something, or mobile? I have to take care. So I don't know. And then try to be happy. Yeah, yeah. I will try to be happy. Remove all the stress from life. Blink. Some people remove from the life. What? Exercise. Yeah. That's a good solution. That helps you to sleep. That helps you to release your happy hormones. That helps you feel better. It increases your muscles and bone density, prevent bone loss. Then skin, obviously, and hard hair will fall, dry hair, whitening of hair, looks will change, then wrinkles, then poor performance. Okay, we have covered the lab investigations. Now there is a hula hoop around DEXA scan, bone density scan. So the question is, after you get that bone density, what is the next step? Are you doing replacement of bones? Are you going to do what? Nothing you are going to do except giving them calcium tablet, which is wrong, because tablet is not the only source of calcium. You can have soybean seeds flour. You can eat soybean seeds. You can drink milk, chicken, fish, eggs, curd, paneer. There is dals, legumes. There are plenty sources of calcium, and you don't need to depend on this. Calcium and protein both. Okay. So some people are like protein powder. Seriously, you remember the story of the intern who used to prescribe protein powder? in the water? Not required. Okay, so you already have plenty of source of protein. Either you are vegetarian or non-vegetarian, doesn't matter. And the protein powder does not fulfill your requirements. So what are you going to do with the DEXA scan? So you can, it's always a good idea to have vitamin D arachidonate nano, one bottle 5 ml once a month or once a week. If it is low, once a week for 4 weeks. If it is not low, then once a month. That restores your vitamin D level, keeps your skin better, then digestion better, intestinal absorption better, nutritional deficiencies will less likely occur if you are taking appropriate meals, and your bones will be normal, calcium metabolism will be maintained. Okay, at this stage it's a good idea to do thyroid, but male population is at a lesser risk of thyroid imbalance as compared to the male population. The higher risk for male population is more about so the memory loss and all those things, and heart attack, diabetes, hypertension. Okay, because of the stress of their life. Females don't have that but same exactly stress of their life, because so typically husbands are good people, so they don't give stress. That's why. Now, whenever you are giving the nutrition, tell them what you are giving, why you are giving. So you will tell them that your primary role is to maintain activity. The benefit of activity, whatever, don't join gym. Okay, you have never done it, you will not do it. Flight of stairs, walk in the garden, do some activity, clean the house, help your wife. You have never helped her, now it's time to help. So all those things, so that these activities help your happy hormones get released. It helps you maintain your cognitive function. You will not lose your mind. You will not get old in your mind. Your memory function is better. Crosswords do not help for memory. Okay, it helps for vocabulary, spellings, but not memory. Okay, then it helps for maintaining your bones and muscle mass. But for maintaining for bone and muscle mass, you need to do one more thing. Visit me every week so that I can track whether you are eating your legumes, soya seeds, soya bean, paneer, milk, eggs, and chicken, fish. Calcium. For calcium, it's the same thing approximate, right? Don't take calcium tablet, because the problem is that not complete is going to get absorbed. Plus, it causes constipation, which is already a problem with elderly population, might be problem. Plus, it can increase risk of renal calculi. You don't want to take calcium, yeah? So, if your bones are weak, you do not need calcium, you need exercise. You need vitamin D, because calcium is already there. Most of it satisfactory requirement is there in your food if you are taking proper food. You need vitamin D and exercise. Now is the time that you are having diabetes, hypertension, then stress, your arteries are getting blocked, narrow, choked, ischemic heart attack, stroke. All these are inflammation, right? So you want to reduce inflammation. What will you do to reduce inflammation? Eat some healthy food, antioxidants. So the sources of antioxidants: cucumber, potato, so tomato, yeah, cucumber, tomato, fruits, berries, almonds, sea fish oil capsule, okay, omega-3 fatty acids. Now, how do you increase your testosterone? This question they may ask, because the performance has decreased, their confidence has lowered. So that may be their rising question. They may ask, how do I increase my testosterone level? So the fastest and the easiest and the safest way to increase your testosterone level is exercise. Okay, 5 days in a week, 30 minutes a day. That exercise may be climbing your stairs, walking around, asking your dog to take you for the walk, taking your spouse for the walk, taking your grandchildren for the walk, play with the grandchildren, go to the garden with the grandchildren, help your wife to clean the house, or do some activities. Yeah. That will be sufficient. Then another is there are claims that certain herbs and all, you should educate them because they are going to fall victim for that. They will buy some so-called medicines sold on Instagram and all, 5,000, 3,000, 2,000. They do not work. Do not work. There is no scientific claim. Okay. So are there some food that might increase? So salmon, fish. Now in vegetarian there are limited food that is going to increase sufficiently. So it is said that this mustard oil and certain nuts and berries and certain healthy fats, so called, they increase. But that increase is not so significant. Okay, because you don't want it to be increased for one day, right? Not sufficient. You don't want it to increase little bit. No, 5 units. No, you want 100 units, 150 units more, and that will come from exercise. Good. You also educate them that do not fall for artificial testosterone injections or steroid injections. Okay, because they have a lot of side effects. You will lose your hairs, you will have more problem with the performance, and they may carry other side effects including heart attacks also, and that is temporary. You cannot continue it for lifetime. Then insulin resistance decrease your insulin resistance and reduce your belly fat. So the best is exercise, apple cider vinegar, fibers, fruits, vegetables, and reduce fats, fried items. Many nutritionists, many doctors, they when they see a patient who is like obese, they say lose weight. They write on the prescription lose weight. It's like as soon as they write, there is some magic point, and then whoosh, the patient is like, yes sir, tomorrow I will come with the lost weight. Yes sir. Bhai, kya hai? There is no magic. Okay. You will need to do a lot of sacrifices. You will need to take certain steps which you do not like. Then you will lose weight in next 2-3 years. Maybe you may not lose weight, but your objective should be to lose fat. So when you tell the client lose fat systematically, slowly, by taking my consultations for next 2 to 3 years. You will not be able to lose it on your own. You will not be able to lose it in 1 day, 1 month, or 1 year. No. Object is not to lose weight. Object is to lose fat. When you lose fat, you may replace, either this may get burned out, or you may replace this fat with the protein. When you replace your fat with the proteins, you may tend to increase your weight. So do not buy weighing scale. Do not check your weight. Right? Your object is to become thin, slim, yeah, and reduce fat. That's your objective. Vitamin D, calcium. I am absolutely against Baba artificial calcium. Okay, tablets. This is just a marketing tactic sold on TVs. All your food component, they are sufficient for calcium if you are eating proper thali. Okay. Now vitamin D may not be sufficient, especially if you are a vegetarian. So the source is vitamin D serum, 5 ml once a week. You can check your vitamin D and B6, B12 levels also in blood. Lab test. Lower inflammation. Try to reduce your inflammation by reducing the stress of your life, removing the problematic people of your life. This is not the time to get for the second marriage. Try to make a truce with the present wife and try to live a good, healthy, happy life. Okay, you should tell this client so that they come to some understanding arrangement. And still, if they have problems, then they can go to Amazon, search my name, Dr. Pawan Mittal, and buy the book of Marriage Relationship Counseling Relate Pillar Test. That will give you sufficient reasons to what is the problem between you, and then solve the problem. Then you can buy couple activity book. Okay. If you don't want to go for that, or what was the topic actually? The topic was inflammation. So the inflammation for berries, nuts, fruits. Don't go for berries, baba. बहुत महंगा है यार. And they are not available also, and I don't like it. Many people don't like it. Okay, so go for almonds, cashews, and pista and all those things if you can afford. If you cannot afford, then go for cucumber, tomato, cabbage. Don't tell people lettuce, very costly, my dear. Yeah, and people don't like the taste. Okay, no one likes the taste. Lettuce. Don't tell people to go for olive oil, avocado oil. Have you checked the taste? And do you know someone is not going to cook for them special meal with that particular oil? It is going to be the oil for the whole family. You cannot manage them, and it is so costly. Okay, normal oil. Do you know what is the cost of the normal oil? 180, 150 rupees liter. Yeah, sunflower. But this all this fancy oil, they are 1000, 2000 rupees per liter. Yeah, hmm? No. If you must recommend them olive oil, don't ever recommend avocado oil. Some fancy hippie who I think. So if you want to recommend them olive oil, then you can tell them put some olive oil on your salad, then you can eat it. But they will say the taste is hideous. Yeah, I agree. So don't say no, no, taste is good. You have to agree to it. No, have you ever tried yourself? You like it, yeah. Others don't like it. Okay. Uh, so better is than apple cider vinegar. The benefit is it reduces your glucose spike. It reduces your insulin resistance. It prevents your weight gain. Okay, and that is better. It delays your diabetes. Okay, but still, if you don't like apple cider vinegar, then you can put it with curd. Your salad crushed, grinded, and with the curd. Otherwise, grated and with the curd. Otherwise, simple salad if you don't like anything. Okay. Don't make life too complex. Ask the client what will you be able to be comfortably manage. Don't ask like me like what you can afford. Tell me. I will tell you accordingly, and my fees will also change accordingly. Barca does this. I don't do. So now in the book I have given the source of this protein, omega-3 fatty acid, fiber-rich foods, antioxidants, testosterone foods, and what are the sources and what are the benefits. By this time you are apparent with the benefits. The sources you can read from the book. Testosterone, there are certain seeds which are pumpkin seeds, fenugreek, garlic. Garlic increases actually. So the another benefit of garlic is it reduces risks of arterial block by atherosclerosis. It reduces inflammation basically. So how do we eat garlic? So you peel it, keep it in the air for half hour. After that, that particular molecule, the precursor which is active ingredient, that reacts with the air and gets converted to something else. That something else is beneficial for your health. Okay, you can either chop it, then either eat it raw or put it garnish. Yeah, the taste is bad and your mouth will also smell bad after this, but you are an old man. You don't need to make a girlfriend to have a good breath, so you can afford that. Okay, but if you still cannot afford that, then you can put a habit of putting garlic in most of your vegetables. I mean, when you're cooking food. Yeah. Now, there are methods to use the garlic. Either you crush the garlic if you want it more spicy vegetable. If you want less spicy vegetable, you chop the garlic. Okay. Further, you don't want the spiciness of garlic, but you want essence of garlic. Then while while onion, while doing your onions in the oil, put your garlic cloves. Don't eat garlic. No, nothing. So if you are eating garlic raw, then after half hour you should eat it. Is there anyone who is eating this garlic raw? Either you are not married or you are married. That is the only diagnosis. Okay. You can try it. It helps. It will keep your problems also away. Testosterone boosting foods. So there is a list of testosterone boosting foods. Now to increase your testosterone, I mean the male, elderly male testosterone, there are certain things which you need. Okay, those things will be zinc, then saponins, allicin, then certain minerals, certain other things. Okay, obviously proteins and all, and magnesium and all those things. So how will you get it? So for each of them there are sources of it. Okay, So it's not only about testosterone, but it also about reducing your inflammation, to reduce your risk of diabetes, ischemic heart attack, and stroke. Yeah, you're already at a higher risk because you are a male. Now you can use our calculator, which we discussed few months back. I will show it again after few weeks. Um, this calculator helps you to identify the risks of you dying with a heart disease, okay, or developing a stroke. Have you noticed that calculator, the first question is male or female? And if you everything is same, if you have female, the risk is lower. If you are male, the risk is high. So males are inherently at a higher risk. So female are protected. And what is that is protecting female? Estrogen. Now when the estrogen is gone or reduced, that time the risk increases. You understand? And by the time they are like 50 years or so, the risk becomes almost equal. Okay. So in the calculator, you can keep all the parameters like 30 age group, okay, all the parameters same, and then change male to female. You will find that the risk has changed. And but at the age of 55, you change from male to female, that risk may not change. And after 60, the risk will become reverse, the female at a higher risk. Yeah. Now there are certain capsules, herbs available, which typically claim to contain something else like tonga tully and all. So I'm not sure, or there is no scientific evidence that certain herbs like tonga tully and all, they help for increasing your uh, testosterone. Uh, but Ayurveda suggests, Indian Ayurveda, that Shilajit, Ashwagandha, and certain other things, mostly they help in increasing testosterone level. Why we are talking of testosterone so much? Okay, because that is going to be the focus of the client. Then garlic, pumpkin seeds, fenugreek. Okay. Now coming to the favorite and the most important part, gut health. Right. So for gut health, you will take food at appropriate time. You will take your proper thali. Now you understand first what are their thali, and you will help them modify the thali for reducing the heart attack risks, for reducing their diabetes risks, and for reducing inflammation. Antioxidants you will add. Remove certain things, add certain things, modify certain things. Okay. Now, modify means put curd, apple cider vinegar, olive oil in their salad. Okay. Increase the salad to 2 units per meal. Then for this also works for the gut. For gut, increase your fibers and probiotics. For probiotics, don't buy costly probiotic syrup because they contain lactobacillus acidophilus. That is there in your curd. You don't need to waste your money on that. You can waste your money on me. I'm going to tell you real things. So, and then next, if you must buy some probiotic, then go for Actico Pro. Because it contains all the microbial flora required in optimum quantity. So what are the sources of probiotics? Curd, buttermilk, kanji, fermented rice, dosa, uttapam, idli, dhokla. And in prebiotics, what will you do? All the fibers, vegetables, right? And put garlic, chopped garlic, onion. Okay. For increasing your muscle mass, not losing your bone density, you will need resistance exercises. Okay. So now we say resistance exercise means gym. No, don't waste your money on gym. You buy 1 kg dumbbell. Don't buy 4 kg, 5 kg dumbbell. Let other people laugh at you. But at least you are starting something. Do a gym of uh, 1 kg. That will be sufficient. Walking, cycling, I don't know, people need to buy a new cycle now. The cycling was a recommendation when everyone used to have primary mode of transport is a cycle. They did not have, majority of people did not have car and motorcycle. Okay. So preferably today will be the walk or run. Cycling has another issue. If your roads are not smooth or it is raining and all, if you sleep, then so something else may happen. And the worst thing is that you will lose the client. Yoga, yoga or breathing you will do, but don't do yoga by watching some YouTube channels and doing something which may not be recommended for you. So when you go to a specific yoga trainers who are certified, they know what your body needs, what you need, and all those things. So you should do them. But without paying anyone, you can do breathing exercise. Most of the yoga trainers charge very less, and there are many institutes of yoga which charge 100 rupees per month, 500 rupees per month. So that is nothing wrong in that. Try to reduce your weight, try to be happy, try to reduce your stress, try to reduce your problems. Don't take stress. Don't worry about things. Yeah, having said that. Yeah. So when a doctor tells you that don't take stress, the next day you start taking more stress because so you're only thinking of preventing the stress. So one day you go to a doctor and doctor tells you there is nothing to be afraid of. Hey, why did you say that statement? There is nothing to be afraid of. When I visited you for fever or cough cold, you did not say that. But today you are saying that. Now the patient gets more worried. So don't say such statements to the client, and don't give them vague statements. All those quoted statements. It doesn't work. For emotions, what you can do is you can make a truce or try to get understanding if it was not there. Find a new hobby, find a new skill, try to learn something new. Don't tell the client do the crossword puzzles, do the Sudoku and all. They don't help, my dear. Yeah. So what helps is the best is the easiest is exercise. Second is cleaning the home. Probably that's why women do not have cognitive decline. Yeah, cleaning the home. Wow, Bhavya is like very happy, very good. Food, exercise, learn new thing, help someone. Help means do not giving to the beggar or not putting something on donation. That doesn't help. And when you are trying to help someone, that someone is should be starting from your home. You want to go outside your home and help people while your spouse is struggling to do all the work. Yeah, while your mother is struggling to do all the work and you want to help outside people. What bad. You want to help other peoples and you are the one who is crying for the help. Your soul is crying for the help. What is that? Start helping yourself. If you had if you do now uh, I will tell you one study. Okay, so the study conducted was about people uh, case control means two groups. Case control means both groups will have same risk categories, either hypertension, diabetes, or maybe not disease, so called healthy. All the age groups is 60. Okay, both are fairly okay groups. And they realize that those who are socially active, they go outside, they meet people, they go to the function, they get involved in the function, they invite people, they engage. Socially active and engagement, they live longer as compared to those who are isolated. So you can choose that. Don't give a vague statement, become social. Yeah, should I go to a pub or a bar to get social? Or should I buy a new spouse? Or go on TikTok and find hey, you are an old person, right? So it's not so easy to get social. Don't do it. So you tell them this study. Okay, to get social, you can start by what is your interest? Yeah, your interest is yoga or exercise, go there. So maybe you can make some old friends over there. You are also old, don't forget. Then if you like cycling, go, or maybe go to the garden and try to make friends over there. Okay, invite people at your home, conduct some session, conduct some what do you call, some kind of get together, food and all, visit other people home, all those things. That is social. Anyone has any questions till now? Please ask questions. So there is a question: probiotic is a fermented thing. No, not exactly. Probiotic is fermenting. Probiotic, technically, fermented things have probiotic, but probiotic per se means those who have microbial flora, the healthy microbial flora which is required for your intestine function. Okay, so where you will find this? You find this in fermented things, including the curd, idli, dosa, dokla, uttappam, and all those things, and pickle and all. Okay, but these bacteria, they also need something to eat. They also need something to grow. That something is called prebiotics. That is fibers. Okay, that's fibers come from vegetables, fruits. But there is something which kills this bacteria also. What is that something? The stress of your life, painkillers, antibiotics, fever, all those things, they kill this healthy bacteria. So whenever you, sometimes you need the supplement. Okay, and that most of the population, the supplement is the curd or whatever is your homemade food, that is sufficient. Do not put salt on the salad. Yeah, so top salt we call it, table salt, top salt. Questions anyone has? Hey, what is this polypharmacy? You want to sell some franchisee or something to the patient? What is this? Improvement of appetite for the old patient. Okay. Are you not happy that you are already made to cook and serve your mother-in-law and you want her to eat more? What is this? Huh. Very good sister, daughter-in-law. That she is worried about my mother-in-law should eat more. No, sir, I am asking this question for my own mother. She is staying with my brother and her daughter-in-law does not cook good food. Okay. So the answer is, ask the daughter-in-law, you, it means your sister-in-law, to cook good food. Or so why people lose appetite? So people may lose appetite because they have vitamin deficiency, nutritional deficiencies, which may be vitamin A, vitamin C, B complex, or vitamin D. Okay, they may have certain mineral deficiencies. So when the intestinal function is not working properly, they do not have appetite. For this, the best part is some multivitamin, like light multivitamin, not A to Z wala multivitamin, which contains everything. I'm not talking about the brand. Okay, so some light multivitamin which is has decent component, which is less strength, and which does not cause a lot of side effects. Okay, with like Zincovit, very light. Supradin Immuno Plus, very light, good. Then vitamin D. Okay, encourage these people to take fibers and fruits because it increases your microbial flora. When you have good microbial flora, your appetite will be good. Movement. Then you should cook good food. Okay, if someone as your family is not eating well, it means you are not cooking good food. So cook good food, number one. Number two is cook something they like. Number three, don't change the thali. See, they are already, there are so many things going on at this old age. You don't want to change their thali drastically. They were not able to do it 20 years, 30 years back. And now at this stage, they don't want to do it. They have no motivation to do it. For what? What is the benefit? If you tell that, yeah, change your oil from your sunflower oil to avocado oil, olive oil. Yeah, tell me the benefit. Tell me scientific. I'm going to spend lakhs to do that. But what is the benefit? No benefit. Okay, don't change the thali drastically. So modify the thali. Reduce certain things, remove harmful things, add certain things. Always this formula. Remove harmful, reduce, add. So Bhavya, don't invent some new words which you also do not know the meaning of. Polypharmacy. Polypharmacy has some other concept, my dear. So you mean some patients with comorbidities tend to take more medicine? Yeah, they will need to take medicine. If doctor has given them medicine, if they have certain condition, they will need to take medicine. I hope you're not talking of self-medication, right? No. Then why you are worried? Doctor has tell them to take medicines. They are taking medicines. You should be happy. Oh, I understand. This question is for your mother-in-law then. Okay. So you don't want her to take all medicines. Very simple. You can tell her that my doctor has said that medicines are not required, or you can stop buying the medicines. You can give her less medicines when you give her on time. So, Bhavya, your intentions are not good, huh? Every time you ask such questions, I need to talk to your husband now. You have some bad plans going on. I hope you are using your earphone. Huh? Other people in your family are not losing. Otherwise, something happens to your mother-in-law, people will come behind you. They will call me, sir, is that happen? I will say, yeah, actually. She asked me this question. I'll give them recording to clear my name, Baba. Huh? I am not recommending anything. You should take proper care. As same as your mother. So, okay, this is a better question. For insulin resistance, symptoms alone can be considered English. For insulin resistance, symptoms alone can be considered or test should be suggested. Okay. So, have you watched Star Wars movies? So, in the Star Wars movies, there is one character, the Yoda, the Master Yoda. He talks this English. Yeah? And it takes a lot of time to understand. So next time Akshara, use the English which other characters use. Okay, my dear. So I will rephrase it. For insulin resistance, can we consider the symptom or test should be suggested? Okay. So for insulin resistance, what is the test you are going to do? Okay. When someone has insulin resistance, they will have higher glucose. Fasting glucose is high, more than 100. They will have high HbA1c. It may be borderline because now it may not be frank diabetes. So what you are asking is probably pre-diabetes condition. Okay. In this, typically people, there is no frank symptoms of diabetes. Okay, polyuria, polydipsia, and all those things. But they will have sugar cravings. If someone has insulin resistance, they will have sugar cravings. So I will explain you the mechanism. You eat the food, okay, the sugar is absorbed from the intestine, it goes to the blood. From the blood, the sugar will go to the cells, all the body cells, including the brain cells, okay. And who will help them? This sugar in the blood, insulin will make them go inside the cells, including the brain cells, okay. But now there is insulin resistance. Insulin level is high, but insulin is not working. Okay, so sugar cannot go, glucose cannot go to the brain. Because it cannot go to the brain, brain feels I'm not satisfied, I'm hungry, I need to eat. I want sugar. Your body says I want sugar, your brain says I want sugar. And that's why you tend to eat more sugar. So the first thing will be probably before diabetes, pre-diabetic patient, they will almost always have sugar craving, sweet craving, dessert craving after every meal. You are having this? Yeah. You are at a risk. Okay. Then now this insulin resistance is because you are eating sugar more and insulin resistance is there. Your glucose will always be high. Because your glucose is high, pancreas will secrete further insulin and this insulin level will increase further. If it is a female, then this high insulin will cause PCOD, blackening of the skin, diabetes. If it is male, blackening of the skin and diabetes. There will be a point when pancreas will exhaust. That Baba bahut ho gaya Baba, ye sweetie khate rehti hai, jane de abhi mein. I'm not secreting insulin now. Okay, they give up. The pancreas give up. Plus, there is a inflammation going on in the pancreas. Okay, because of certain things. There is no scientific data that antioxidants help it, but at least to fool yourself, you can eat some antioxidants. Okay, not antioxidant tablet because it is not fresh. What is antioxidant? It gets very fast neutralized when it comes in contact with the air or the oxygen. It stays longer. That's why you need fresh vegetables. You need fresh fruits. There is a capsule which contains the essence of the cucumber. Doesn't help, my dear. Everything good has gone already. Oxidized. It has combined with the oxygen in that capsule itself and gone during the process. If you cook a vegetable, it is gone. So try to eat fibers, vegetables, salad. But earlier there was a recommendation that when you eat salad of fruits, do not peel it. Okay? Do not remove the peel, skin. Do not peel it off. But now the recommendation is peel it off because of the risks of infection of parasites. What fertilizer they use? Yeah. So that's why you want to peel it off. So insulin resistance per se, you are not going to see it isolated condition. Okay. So it's basically pre-diabetes, and we are not measuring insulin level in the blood. We are measuring HbA1c. That is an indirect test for insulin resistance. Okay. So HbA1c means in the RBCs, they have been exposed for more than 3 months for high blood glucose. That's why HbA1c is more. And because HbA1c is more, it means we conclude that glucose level was high. It means either there was no insulin, type 1 diabetes, or there was insulin resistance. Okay. For research method, you can check the blood insulin, but clinically it is not required because the management is not going to change. Now don't be afraid, ask more questions. All of us, we get entertained by your questions. No sir, I'm not afraid. I have a very systematic plan. My name will not surface. Okay. Sir, how to deal with patient with chronic constipation, not improve with diet? So chronic constipation, that is a good question. What is the age? What is the age of this patient, Bhavya? So chronic constipation, the number one cause may be hypothyroidism. Everyone forgets that. Number two may be, are they taking calcium supplement? Constipation. Number three, are they taking iron supplements? 75 age you are asking. Okay. So maybe a relative there. So are they taking calcium? Are they taking iron? Both of them cause constipation. Do they have a hypothyroidism? It may be because of age factor. Okay. So it may not improve with diet only. So you can increase the vegetables, you can increase the water. But when you increase water, the problem is, especially in the evening, if you increase, they will have to get up in the night to go bathroom. That is not comfortable. So you don't want to do that after 9 p.m. You want to restrict the water. In the daytime, you want to keep the water. So the fibers. So then you will need something. Okay. So that dulcolax syrup and all those things, so that it increases the motility of the intestine. Okay. Now someone may ask, will they get habituated? Yeah, the age is 75, age is 70. Let them be habituated, but at least let them feel better. Okay. It happens with the age, dear. So the body stops working properly. Questions? Any Ayurvedic medicine? Yeah, there are many Ayurvedic medicine. That Churan and what is that? Something, Isabgol, and there are many Ayurvedic medicines. Yeah. There are allopathy medicines also, like Dulcolax, which increases the motility of the intestine. Simple, go on Amazon, find any medicine for constipation. They will show Ayurvedic medicine, whichever has higher scoring, buy it, done. Try it. If it helps, okay. If it does not help, stop it. Simple. Or visit a Ayurvedic doctor, or whomsoever doctor is treating them, tell them this problem. They will add some medicine, allopathy. Okay. Diet may not help in this case. Less mobility also causes this problem. Questions, anyone else? No question? Should we go to the next chapter? The favorite, lactose intolerance. You want to hear the lactose intolerance? Okay. So, understand what is milk. In milk, there is a complex carbohydrate called lactose. Now, in your intestine, you need an enzyme lactase to break this lactose into smaller sugars, one of which will be glucose also. Right? Now, this lactase is less. In some people, it is inherently less. In some people, over the time, it gets less. After a particular age, they are not able to tolerate lactose. Now, how much less? It can be 10% less, it can be 90% less. Someone who has 90% less, they will have more side effects of lactose, drinking milk. As soon as they drink milk, they feel bloated, they feel discomfort. Yeah, they may have diarrhea, they may have pain. Okay. Now, someone who has majority lactase is there, but it is less. So they may tolerate 100 ml milk, they may tolerate tea, but when they drink milk, one glass milk, they suffer. Tea is okay, 50 ml, 100 ml, but glass of milk is not okay. Okay, that's why. So there is a range. Lactose intolerant, lactose sensitive. Sensitive means lactase is little less. It is there. They can tolerate, they can manage some milk. And then lactose intolerance means they have very minimum lactase. So what is the solution? The best solution is lactose free milk, which is the easiest solution. Don't go for almond milk. Have you bought it anytime ever? You cannot afford it. It's costly, my dear. And the logistics is different now. If the tea is cooked at home, yeah, the logistics is different. Everyone will not like the tea made with almond milk. And I don't know whether you can make the tea of almond milk. Because for tea, you have to warm it, cook it. Okay. Then another answer someone may give is soya milk. Yeah. Why you want to do that? There is a simple answer, the low cost answer, equal taste, equal thing. All the dishes which you can make with your milk, you can make with lactose free milk. What is the cost of normal milk? 20 rupees, 200 ml. Amul I am talking. And lactose free milk, 25 rupees, 200 ml. Amul lactose free milk. Good idea? Approximately same cost, approximately same taste. You can make all the dishes which you make with this milk. You liked it? Don't jump that line to almond milk and fancy hula hoopa milk. That utility is not there. And anyway, someone who is lactose intolerant, they are not going to crave for the milk. They are not going to, I want to drink milk, but I am lactose intolerant. No, my dear. And that's why they should drink almond. That justification is wrong. So already they have aversion for the milk. Now whatever milk they want to drink for whatever reason, whenever they need to, that will be lactose free milk. You liked it? How do you diagnose? Very simple. From the history. So what will happen with the lactose intolerant people? So whenever they take milk or milk products, they feel discomfortable. They feel bloated, acidity, pain in stomach, diarrhea, vomiting, nausea, all those things. Okay, or some part of it. Someone may tolerate one glass of milk, but they cannot tolerate two glasses of milk. Someone can tolerate one slice of cake, but may not tolerate two slices of cake. Okay. Someone may tolerate tea, but may not tolerate that ras malai or something. Okay, the milk sweet dish. Okay. So it may range. They know their diagnosis typically. They say that after every time I have milk products, I have this difficulty. What you do, you stop all milk products for 1 week. How was your feeling? Good. Now today you take milk. How are you feeling? Very discomfortable. Your diagnosis is confirmed. You are lactose sensitive or lactose intolerant, whatever it is. You don't need to do some fancy test and all. Hydrogen breath test, then stool examination and all. Okay. Because the logistics itself is difficult for that. Okay. And that cost is also involved. Plus, then the patient, you lose the patient to pathologist and then the doctor takes over. You want to retain your patient who has come to you after so many difficulties. Yeah. Then there are some recommend genetic testing. Yeah. After you have checked your genetics for lactose intolerance, after that, what are you going to do? What are you going to do? Is there medicine? Is there a genetic capsule you will take and fill that gap? No, na. Then keep quiet. That's from simple history you can diagnose patient has lactose intolerance. And there is no treatment for that. The only thing is lifestyle management. Very easy. Neither you need to exercise, neither you need to stop anything, neither you need to add anything. Only thing you need to avoid is milk. But if you must drink milk, then drink lactose free milk. End of story. So this is the simplest chapter actually. Obviously in the book there are a lot of things. Now typical common question. Can I take curd? Yes. Because the lactose in the milk was utilized by lactobacillus acidophilus to convert into something else. And this lactose is gone now. So curd should be okay. But sometimes patients say, no, I'm not able to tolerate curd also. So simple, you dilute the curd 50-50 or 50 ml curd, 150 ml water. Make it a tak, put jeera and salt. You can look for shifting to black coffee, green coffee, black tea, or you can look for shifting to lactose free milk. What is the benefit? Is there any benefit if you are not lactose intolerant? If you're not, okay, you're a normal human being, so called, and you stop taking milk. Is there any benefit to it? Write down the chat. What are the benefits of avoiding milk? The number one benefit is you will have fresh breath. Okay. So there are people who brush their teeth, clean their mouth, and the first thing they do after that is dirty it again by drinking the milk tea. Yeah, done. And then the whole day they keep smelling. So the number one benefit, your breath is fresh, you don't smell from the mouth. Number two, your skin becomes younger. You feel light. Okay. Because with milk, comes the fat, with milk comes the sugar, with milk comes the extra calories. As an adult, you are already taking care from other things. If you avoid this part, you are reducing certain fat and sugar and calories. That is something which you can delete from your life. If you are decided to go lactose free, then you will not eat your rasmalai and many of the desserts which are which are made with the milk. And then one day, when you stay longer for lactose free diet, one day when the cake is present in front of you, you will feel that this cake has a smell of milk, and you will avoid this cake. Wow, that is healthy for you. So you are delaying your onset of diabetes, and you are not getting, I mean, whatever fat you have, you are not getting fatter than that. So you are on the path of healthy lifestyle. Now there is a question, coconut milk. Coconut milk is good because the taste is good. The cost is also comparable in many places. Okay. But I'm not sure if you can make tea out of coconut milk. Yeah. Probably you can make coffee, cold coffee out of coconut milk. Accidentally or because of certain your impulse or lack of control, you are drank the milk in form of some sweets, dessert, or something else, and now you are not feeling good. What will you do? Do you remember something from gluten sensitive chapter? Activated charcoal tablets, the best thing, right? So what you need is you need to absorb, you need to give a surface that will absorb, not absorb, absorb your milk on that. So it will reduce your symptoms little bit. The question may be, can I eat cheese? Can I eat butter? Can I eat ghee? Answer is yes, because there is a minimum lactose in that. Can I eat curd? Minimum lactose. Okay. So what is the other dairy product that we can consume instead of milk and get the benefits? So instead of milk, you can consume curd, ghee, cheese, butter. Yeah, this is not a class for preventing heart attack. This is a class of replacing your lactose, replacing your milk. So the best is the curd, approximate match, right? All the benefits plus microbial flora plus probiotics. That's the biggest benefit. Plus the taste is better, right? And if you want exact same taste as the milk, then lactose free milk is the best substitute. Okay. And if you want to like show off and be fancy and hula hoop, then you can go for almond milk. I'm not sure, Bhavya. Like Bhavya is asking, does lactose sensitivity has circadian rhythm? So I'm not sure. There is nothing, no study that says certain thing like that. Okay, and someone who is lactose intolerant will be lactose intolerant in the night and the day, both the times. Now, if you are asking this question, why? Because you might not be tolerating the milk in the night. Okay, then you should avoid it. That's a simple. But it's not about the lactose part, dear. Okay. What do you get from the milk? You get certain nutritional supplements, nutritional requirements, many of which is burned out because of repeated boiling and processing of the milk. You get proteins, calcium. That's the major thing actually, and the taste. All those things you can get from the curd, and for taste you can go for lactose-free milk. So sometimes there are, so you may not tolerate certain food item after afternoon or evening time. So that is a time you should see your kundli and match which food item matches with your kundli and what time you should take, and you should take accordingly. So maybe that answer lies in some Ayurveda or something. Yeah. and you should eat the food whatever suits your system. You should eat at the time whatever suits your system. Okay. If you can tolerate milk before 3, it means you are not lactose sensitive. So you can still continue it. Okay. Barka is going to do this today only. She is going to check her kundli and astrology and then start drinking milk and decide the time, what time I should drink. She got this idea very well. No, sir, I'm not going to do with the milk. I'm going to do with some other food items like sweets. So I'm going to ask my Pandit what time if I eat, it will not cause me, so gain fats and all those things. So then there is a list of the items which are lactose free but originally come from the milk. Okay. I have mentioned some for some hippies also. I have mentioned some food items including almond milk and certain other milk. Where is that? Tofu, oat milk. You don't need tofu here. Okay. So paneer also has less lactose. So that is okay. So what do you get from milk? Again, coming back to the question, calcium and protein. That exact thing you can go get from curd. Problem solved, crisis averted. Then you get vitamin D. Okay, you take simple liquid of vitamin D. Most of the vitamins, including vitamin B complex, they are already gone by the time you process your milk, boil your milk, reboil it. Then what is another thing you get from milk? That is it helps for digestion, probiotics and all. That again you get from curd. Phosphorus, magnesium, zinc, all this will be maintained in your curd also. So you don't need to worry about that. So always remember, there are 3 things, okay? Water soluble vitamins, water insoluble vitamins or fat soluble vitamins, and minerals, okay? Minerals, they don't get destroyed easily when you process for any food item. Then water insoluble or fat soluble vitamins like vitamin A, D, E, they don't get destroyed easily. But water soluble vitamins, they get destroyed very easily. All B complex, vitamin C. If you wash, if you keep it in after chopping, if you wash or keep it in air or cook, they get oxidized. Any antioxidant which is there in the food, that gets oxidized when it comes in contact with the air. So after cutting or after cooking, when you increase the temperature of the food. So you should not worry much if you miss on water soluble vitamin, because that is something that already you have stores for that, or that is something which you are already taking from something else. That is something which you can always take some tablet with minimum side effect. Plus there are plenty of food sources, including vegetarian sources, that will give you water soluble vitamins. Minerals also same story. There is another favorite chapter which is called gluten sensitivity, my favorite and the best chapter. In that chapter I have written one bonus chapter also in the book. You will get it soon, don't worry. So you will get it where it is written about avoiding gluten even if you are not gluten sensitive. So we will take that only today. Yeah, gluten sensitive is a bigger chapter. We will take it later. Okay. So what are the benefits of gluten-free diet? You like this question? Yeah, sir. I want to shift to that. Yeah, it's not so easy to shift. Huh? It's very tapasya. So what are the benefits of gluten-free diet? Number one benefit is you will feel light. You will feel happy, you will feel relaxed, you will feel calm. Okay? Gluten is difficult to digest. You will have better microbial flora. You will have less smell in your breath. Okay? Or no smell in your breath. I'm not talking about only mouth, but also mouth and breath. Okay. Then the best part is your emotions will be good. You will feel more happy, calm, and anxiety will be less when you are on gluten-free diet. Because of microbial flora, because you have good microbial flora, serotonin is optimum. Because serotonin is optimum in intestine, it goes to brain, gets converted to dopamine. And dopamine helps for prevention of depression and anxiety. Right? Then what are the other benefit of gluten free? Reduce wrinkles. Have you seen these Chinese and Asian people? Yeah, 50-year, 60-year women, they look like our 30-year women because almost gluten free diet. Okay, the rice and the chicken and the fish and all those things, or rice and vegetables. Right? So gluten free diet, it reduces your aging or the signs of aging. Yeah, the physical changes of aging. So less wrinkles, the skin will become glowing, the skin will look good, you will look younger, you will look thinner, slimmer, and good. You will feel good. You are, yeah, you are only smiling. You are not going to do it. After the listening to the benefit also, you are going. You are like, sir, I want to do it. Yes, yes, but there is no motivation to do it. And once you are married, then absolutely there is. This motivation is already gone. Only motivation is, will I feel happy? So answer is yes. So for if you are like someone who is searching your happiness, then you can go for gluten-free diet. Okay. You need to take one more step actually for your happiness. You need to remove the stress of your life. Everyone knows by this time what is the meaning of the stress in their life, except Barka because she's not married up. She will realize this problem after the, that event. Where was I? What is another benefit? There is no scientific data, but there is a research conducted by Dr. Pawan Mittal which shows that it increases your survival life expectancy also because your wife does not need to cook chapati for you. You can survive on rice. Yeah. So, and you don't go hungry now anywhere you go because you don't crave for your chapatis. Yeah. You are like, yeah, what will you eat? Rice and dal, rice and aloo, rice and vegetable. So you are a happy person and you don't give trouble to others. When you don't give trouble to others, you survive longer. This statement is actually written at multiple places. Any question about gluten and the benefits of gluten-free diet for normal human beings? No, Bhavya, you cannot start gluten-free diet for your mother-in-law. No. People have to choose their own. No, I want my mother-in-law to live longer, so I will start gluten-free diet. No, that is a punishment for her. Your objective is that. Then you can do. Any other question? We'll take next class gluten-free all those things. Yeah. Without being hula hippa and hippies. The real thing, what you can do when someone has gluten sensitive. How do you know that? So every time they have meal, they feel acidity, they feel bloated, they feel discomfort, stomach has come out. Sometimes they feel pain, sometimes they feel diarrhea, constipation. And it does not happen on all days. It does not happen on the days they do not realize. On the days when they eat only rice or pula or khichdi. So coincidentally those days they do not have. But certain days they have. Now it is in the range. Someone will be gluten sensitive a little bit. Someone will find gluten intolerant. And you may develop it in later stage of your life. Or you may identify it in later stage. It's not necessarily only diarrhea. It can cause constipation also. So if you have diarrhea or constipation or discomfort after every meal, you need to reduce two steps. Two people. You need to reduce two things from your life. One is someone in your life, and then the next is the gluten. You try it. Once you reduce both of them, one of them and one of this, you will feel much better and happy in your life. True story. The secret of happiness is the stress-free and gluten-free diet. Okay, so Bhavya, the question Bhavya is asking is, sir, how will I make the patient come to us for years? So the question is, I got a client, but I want to earn more from this same client. That is a question. So the answer is, don't stick to nutrition and diet. Okay, that is only one component. It's majority about counseling. Explain the client the mechanism and the pathophysiology. In the book, you will read the pathophysiology for non-medical graduates, and that is something you can explain to the client. This condition. When the client shows you the lab report, you watch my video of lab report interpretation and explain them. This is how you are going to interpret the lab reports, and you are going to make them understand. Don't just say things are normal. That doctor has already done that with them. Yeah, you should do something more to make them explain better, to get a new knowledge from you. Don't tell them that you need to reduce weight. Yeah, I know that. So explain them why, what, how. Okay. Then every time you have to tell the client, you need to come back to me every week and pay me the fees if you want to survive longer. I mean, if you want to feel better, or if you want to prevent diseases, if you want to have better quality of life. So you need to tell them. Yeah. There is nothing wrong in telling them you need to come and visit me every week. Doctors, they write follow-up visit after 1 week. So why you are ashamed of writing, saying to the client, come to me after 1 week? It's absolutely okay to say that. Okay? And don't be so greedy also. You should be greedy, but not that I want every client to come to me for years. That happens only in marriage counseling actually. If you want to earn that much money, then you choose your field, marriage counseling. Yeah. You learn from us marriage counseling. You go to Amazon, buy my book, Marriage Counseling Relationship Test. There is a happy couple. Today they come to you for nutrition counseling and you run the test from the book. The test name is compatibility. And you tell them now you are not compatible. Problem solved. You get the client for lifetime. Right? Then there are 25 tests. Each test takes 4 to 5 sessions. Okay, means every week if you do, it takes 1 month. So 25 tests, 25 months, 2 years already you have the client. Wow. And once you ignite the problems, then you can do the marriage counseling, couple activities and all those things. So client will stay for you for longer. So if you want to earn more, like years, Bhavya, from every client, then the choice is not nutrition, my dear. The choice is marriage counseling. Okay. But I like this question. So the question translates, can I have more visits by the client? More, yeah, maybe few months or few weeks. So yes, you can tell the client. You can explain them better. You can give them the reason for them to come back to you. So Akshara is writing a cute question. So is it better to use country cow milk or Jersey bred cow milk, or both cause same problems? The problem is both are cow. It's not about the cow. It's not about the goat, the camel, or any other animal. Okay, the milk is the milk, and the milk contains lactose. Problem is the lactose, my dear. Okay, and unless you have the cattle shed at home, you cannot choose which milk you are getting. Okay, a milkman coming to you and telling that this is a Jersey cow milk, I guarantee you there is a urea and artificial protein in that, because they are mixing all the milk, my dear. And there is no benefit of country cow milk versus Jersey cow milk. And have you tested it? Country cow milk, uh, country cow gives less milk, okay, and Jersey cow gives more milk. Both the milk technically taste both the milk technically have both same content, lactose. Lactose is what is problem, not the cow, okay. But anyways, if you have your own cattle shed, then you can experiment. One day country cow milk, 1 week I mean. How are you feeling? Then Jersey cow milk, then Gir guy, then other guys, HF, Holstein Jersey. You can do all those things. I have 60 cattle. No, now 80. Now more than 80. So in my cattle shed, I have 80 cows at my farmhouse. I also experimented this thing. What Akshara is saying, I also was tried with Gir guy. Then I did not try with country cow. I don't know. I should try now. Then Holstein Jersey, then Jersey and all those things. HF doesn't help, yeah. Because all contain lactose only. I asked one cow also, will you give me lactose free milk? She said, yeah. It's available in the market, big basket. Go there, search lactose free milk. You will find the packet Amul lactose free milk. So the cow said yes. So I bought it then. Why Gayatri is so sad today? No? Your camera was also off. You are looking sad also today. I understand. Understanding issue. I understand. That's a code word, so people surrounding should not know what. Any other question anyone has? So we'll meet next Sunday. Yeah. Have a great time. Enjoy. See you. If you want to talk to me, Monday to Friday, 1 to 5 p.m. No messages on Sunday. No messages late night. No messages after 5 p.m. If you need urgent help in the middle of night, you should visit your nearest hospital. Do not WhatsApp in the middle of night. Have a great time. Bye.